Okay, welcome to the lecture material on interventions with couples. Of everything that we cover in this class, I'm going to test you on this one the least. So I would check out the multiple choice study guide to see kind of what to expect for this material. Okay, so therapists generally are trying to change our emotions, our cognitions or our thoughts or our behaviors. And most therapies get at, all of these, but some they go at directly and some it's more kind of indirect. And so you can think of this as a therapist, which door are you going to go in? Are you going to go in the emotion door, the cognition door, or the behavioral door? And so, for example, emotionally focused therapy, as its name suggests, goes in more often than not the emotion door. Gottman really initially goes in the behavioral door. That's the door that Gottman prioritizes. Now, generally they all are going to get to emotion, cognition, and behavior, but they have kind of the way in that they prioritize. And Davis did some nice research on the empirically validated couples treatments and helped us understand that regardless of the approach, the common themes were that they really slow down couples conflict. And we're going to get into some examples of that. So really kind of go through it play by play, what's happening emotionally, behaviorally, cognitively. They get people to, with that kind of stand meta means basically like step out of the content of your argument and look down upon the pattern or the cycle. So not about the chores, but about the kind of patterns in how you approach and withdraw, for example. And then the third part is, owning your own part, right? Because generally we usually think initially that it's the other person's fault. Okay, so test yourself on this, and the answer here is behavior. Gottman prioritizes behavioral change, although he does get to all of these areas. Okay, test yourself on this one. EFT, as its name suggests, prioritizes emotion, even though it will get to all of these elements. Okay, so in this lecture, I'm going to first talk about emotionally focused therapy for couples. Then I'm going to talk about the Gottman approach for couples. And then we're going to go over some kind of take from these two approaches some general skills that you can use when you're working with dyads, like how do you talk when more than one person is in the room that are related to each other? So a parent and a kid, for example, or a caregiver and a kid, or a couple. It's challenging to navigate, especially people in conflict who have differences of opinion, to be able to talk to them both at the same time. And so we'll get into those skills. So let's get started with emotionally focused therapy for couples, or EFT. EFT was created by Dr. Susan Johnson. There's extensive training. She's written many books, developed workbooks, workshops, so many incredible resources. And I mentioned to you that this was the therapy that I trained in when I was a couples therapist and specialized in, and then have offered some workshops based on her book, Hold Me Tight. EFT is one of the most highly researched couples therapy approaches, and it's empirically validated, which means it's been compared to other couples therapies or control groups and found to be effective. You can see there the results showing, about a third of couples show clinically significant improvement following EFT. These are often, maybe like a dozen sessions of EFT. And then EFT has been specifically studied with a variety of, specific populations. Depression, chronic illness, trauma, eating disorders, cancer, for example. This video from Sue Johnson helps us understand how attachment theory is really a theory about love. Okay, you can test yourself on this, and the answer is emotional responsiveness. Okay, so EFT is going to focus on that pattern of interaction, that problem cycle, rather than the content of what couples are talking about. It's going to try to help people get in touch with their more vulnerable emotion, especially their fears of disconnection, fears of being unlovable. These are often fears related to our internal working models. You'll recognize that. And then it's going to help couples really tune in to what it feels like when they're connected and what it feels like when they're disconnected, and how those feelings of disconnection kind of fuel their patterns. It's going to be really using attachment theory, of course, to validate their needs and fears and really help them communicate in a more vulnerable or emotional way. So even though it's couples therapy, couples therapists almost always do individual assessments following the initial couples session. And common things that they ask about are, relationship commitment and satisfaction, also kind of getting a sense if there's been any infidelity that hasn't been disclosed, addressing any concerns about substance use. So sometimes one partner's use is bothering the other, but they're hesitant to talk about that within the couple. Of course, screening for domestic violence or intimate partner violence, which we'll be talking more about in an upcoming lecture. And then, because this is attachment-based, this therapy, we are trying to get a sense of people's attachment history. If during growing up they had people that they could count on or not. And then we're also trying to get a sense of significant adult relationships, either prior relationships and whether or not those were insecure or secure attachments. And then kind of what's significant about this relationship. Have there been any attachment injuries in this relationship? Significant times where they felt like they turned to their partner and they were not there for them. And maybe in a moment where they said, okay, I'm not going to turn to you like this anymore because I can't count on you. Maybe some sort of medical event or family crisis that was kind of a turning point in the relationship that did some damage that maybe we need to repair. EFT therapists are always going back and forth between two types of skills, helping couples understand their pattern and begin to shift it, their cycle, and then helping them deepen their awareness of their emotional experience and share it with others. I'm going to go more in depth in each of these sets of skills, starting with the skills for tracking and restructuring cycles and patterns. And so the three sub-skills here that therapists are using are their tracking and replaying the interactions that are either happening in the room or that the couple is talking about that happened, last week. And then they are reframing people's behaviors in the context of the cycle, putting what they're doing in the larger pattern, and that will become more clear, and reframing it in terms of attachment. And then they're beginning to change, basically like direct the dance for how couples interact and change that in the session. So here's a simple handout that an EFT therapist might use to guide their sessions with a couple. And so they're going to be trying to kind of fill in all of these blanks for each person. They're going to, determine kind of who's more the pursuer, who's more the withdrawer, and then they're going to be talking about, what's their behavior when in conflict, right? What's their behavior? What are they saying to themselves about themselves or their partner? What are the emotions that they're typically more aware of? These are more the kind of surface emotions. Then what are the deeper, more primary or vulnerable emotions, often associated with the internal working models? And then what are their unmet attachment needs, usually associated with connection? And so the therapist is trying to get a picture of this and begin to frame everything in terms of this map, but that in order to help couples begin to see this as well. And, our goal is to help get them not to just do the cycle, but to be able to talk about the cycle and what they're doing and recognize, oh, I'm doing that thing again where I say to myself, nothing's ever good enough for you. Or I'm doing that thing again where you seem to be getting quiet and I come after you, So starting to kind of see it in terms of these common patterns. Okay, so you should remember this cycle from the couples and attachment lecture. And so you remember this, Sally being more the pursuer, Nancy being more the withdrawer. It exemplifies both, family systems and also attachment theory. And we're going to use this to complete the worksheet on the next slide. Okay, so if we take that cycle and we put it in terms of this worksheet and kind of do some guessing about what might be happening for Sally and Nancy. Again, we're going to think of Nancy as the withdrawer. We're going to notice that her behavior or action tendencies are to defend herself and shut down. She might be thinking something like, nothing's good enough for Sally, or Sally doesn't understand the importance of my work. Her more obvious secondary emotion, the one she's probably more aware of, is being overwhelmed. Now, we're going to talk more about accessing deeper emotions in a few slides. Once we do that, Nancy might start to become more aware that she has a deep feeling of inadequacy or being ashamed of not being, good enough. And perhaps her unmet need is to be valued for who she is and what she does. Sally is the pursuer. Her action or behavior tendencies are to criticize, to be demanding, to amp up. What she may be saying to herself is, Nancy doesn't care. I have to do everything myself. I'm alone. Her visible, kind of more, obvious emotion is anger, frustration. Her primary emotions are, that she's more alone, afraid that she's somehow not lovable. And her unmet attachment needs might be to be seen and understood. She may be feeling invisible to Nancy. So, how does an EFT therapist figure this out? Well, sometimes couples are actually having a conflict within the session. So you can kind of see the cycle happening and begin to track it. And we'll talk more about those on the next slide. But sometimes you're having to almost kind of get it going a little bit, have them talk about a time in the last week or so that they felt disconnected. And then you're starting to kind of get that as a play-by-play, like play it out for me like I'm a fly on the wall, or, scene by scene in a movie. And so that can be a way that you begin to get a sense of the cycle. You can also be kind of asking questions not only about times of disconnection, but also times around reconnection or connection. Like when's the last time you felt close? What's that look like? Who reaches after you've had a fight? How do you reconnect? Or back to the disconnection, when you're feeling disconnected, what do you do? So here's language that an EFT therapist would use to track the cycle or unpack a conflict, whether happening in the session or talking about one that happened, out of the session. And so you are kind of thinking about that cycle worksheet that you saw, tracking the behaviors, the thoughts, the reactions, the secondary emotion, primary emotion, attachment needs, and maybe the overall kind of consequences of the cycle are usually that people end up feeling alone. So you're doing all of this you're starting with maybe one person, let me understand what's happening with you, and then you're kind of saying, and then for you, how did you respond to that? So you're kind of going back and forth, paraphrasing what they're saying to you, but putting kind of an emotion and attachment spin on it. And of course, with that idea of a pursue withdraw cycle. So you're kind of creating this framework. And even as you progress in therapy and start kind of going maybe more deeper into kind of attachment needs and fears, you're always putting it back in the context of the cycle. That's kind of the stage that you've created that everything's happening within. Within this first set of skills on tracking and restructuring, the second set after tracking the cycle is reframing behavior. And so EFT therapists are always kind of, as they're tracking and reflecting back, they're putting it in the context of attachment, connection, disconnection, a desire for connection, fears around disconnection. And so they are often reframing pursuers in their kind of anger and demandingness as fighting for connection. They're trying to find their partner. And they're often reframing withdrawers rather than like they don't care. They're actually protecting the relationship, and maybe themselves from further damage. They just are feeling like, so for example, actually, if we were to go back to that Sally Nancy cycle, how we might say that is, Sally, I know that you're, Nancy perceives you coming across as angry and critical, but it sounds to me like you're feeling disconnected from Nancy and you're just scared you can't find her. And so you kind of come after her. And you might say to Nancy, I can hear that you get overwhelmed and shut down, but I wonder if it's because you're not sure what to say and you think that everything you're doing is making it worse, so it's better not to say anything. Attachment needs can activate when we have things external to the relationship that are stressful, like maybe something with a friend or a family member or jobs or a big transition in life. And so we're just expecting more from our attachment figures, for comfort, like that safe haven idea. And then it can also be because we perceive a disconnect with our attachment figure. And that can bring up our attachment needs. So, for example, if my husband's on a guy's trip and he's calling me and telling me how much fun they're having and it all sounds so great, maybe I'm thinking, I don't remember you being that excited the last time we were on a trip together. And I might feel kind of, a sense of disconnection. And that might lead me to be a little bit more in my pursue position. I might be more critical when he shows up at home. So attachment needs can really kind of amp up our pursue withdraw patterns. Okay, here's the third tool that EFT therapists use when they're doing tracking and restructuring. So once they know a couple and their cycle, and couples are seeing their cycle, then we begin to ask them to change how they talk to one another. Say things they wouldn't normally say, share vulnerable emotions and attachment needs. And so how you do that is first, and this is where EFT is really different. You don't just talk about it in a cognitive way. You get them into a place where they're actually experiencing that emotion. And we're going to talk in the next slides for how to do that. And then once they're in feeling the emotion, you ask them to turn to each other and say, what it is that they're feeling. So you might say to her, for example, you might say to a partner, like, I can hear that when she gets quiet, you get scared that she's not happy with you. Can you turn to her and tell her that, in your own words? And then what you do is you go back and validate, like after they say it, before the other person responds, if you can, you try to say, wow, what did that feel like? That was risky to let them see that part of you. How did that feel? And they'll often say like, wow, that felt a little scary, which I think is great for the other person to hear, because then they're a little less likely to slam them for that. And then you go to the other person and say, what's that like to hear? And you're hoping that they're really being kind of validating and comforting. Now, oftentimes, they're not, especially when couples are really angry and in the beginning. And you're going to see that in this clip, that Sue gets the wife to really share from a vulnerable place her needs for reassurance to the best she can. And then her husband responds with basically defensiveness and anger. And so in that case, the therapist has to do something that's called like catching the bullet, so that this woman in her vulnerable place doesn't just get slammed, And so what you might say to this man is something like, so when she tells you that she needs to hear how important she is to you, that ends up making you feel defensive and angry. Is that right? You hear it as she just wants more from you. You're not really hearing how important you are to her. Something like that, right? Okay. So after the tracking and restructuring set of skills, now we have the second set of skills around exploring emotion. And you remember from the cycle worksheet, right? EFT therapists are identifying the secondary and more visible emotion, and then they're going deeper to see what's the more vulnerable or primitive emotions, attachment-based emotions that are beneath that. And so EFT thinks of emotions kind of like the layers of an onion, right? We see that external layer for the pursuer, that they're angry. As we are going to continue to walk around in their emotional experience, and I've got some skills for you for that on the next slide, then we're going to start to realize that underneath that, they're often hurt, alone, they're feeling unimportant, abandoned, disconnected in some way. Withdrawers often their initial kind of outer layer is, I don't know, nothing. I don't know what I feel. I feel fine. I feel nothing. I'm not sure. Bad, and because you have to remember, they've coped by not focusing on emotions. They've focused on tasks instead. So oftentimes withdrawers don't have a big emotional awareness or emotional vocabulary. And so they're going to need help with that. And so nothing is always something, is what I learned. It took me a while, because the first time I was working with a withdrawer, and I, was like, when she comes after you and she's really critical, and how does that make you feel? And he was like, I don't know, nothing, I guess. I was like, okay, great. What am I going to do now? Now I know that what you would say is like, so when you say you feel nothing, I wonder if when she comes after you or she gets frustrated, you kind of go away a little bit because it's too hard to face that. Is that kind of what happens? And so then if you keep circling back and walking around the withdrawer, they often will start to talk about words like I'm overwhelmed, I'm inadequate, I'm a disappointment, I'm going to be abandoned, I'm ashamed, those kinds of things. And so you're just trying to kind of deepen each person, kind of going back and forth. It's easier to stay with pursuers because they're talking a lot more. But you don't want the pursuer to be at layer 4 and the withdrawer is up here at layer 1, you know? So you're trying to get them both kind of inched down little by little, but at the same time. So these are the types of skills an EFT therapist would use to explore and kind of deepen couples' emotional awareness, getting them from layer 1 down to layer 4. So there's just basically reflecting their emotional experience, whether that's primary or secondary, and oftentimes you're putting that within the context of the cycle. So when you see her get angry, you respond emotionally by just feeling numb. It just feels like too much to handle. Is that right? Validation is taking it a little bit further. It makes sense that you would feel frustrated or angry when you feel like your voice isn't being heard. Evocative responding is where you sense that there's some emotion beneath the surface and you're trying to draw it out a little bit. You pick up on a tone of voice or a nonverbal cue. You know, what's happening for you right now as your mouth tightens and you look down. Heightening is where you've got an emotion and you're trying to kind of intensify it to make them actually more vulnerable, especially right before an enactment when they turn to the other person. You want them to be in a more vulnerable place so that it kind of pulls the partner to them. And so you might say something like, it's like you're saying, it's just too scary to let you in. I just can't believe that you really want to be with me. I'm too afraid to let myself believe that. And then empathic conjecture is basically guessing or interpreting. So especially if someone's staying in layer 1 and you're trying to get them a little further, you know, as I listen to you talk about how angry you are, I also get a sense that there's some tears in your eyes, and I wonder if you're hurt too. Does that fit? And then seeding attachment is where you're planting a seed of where a couple isn't now in terms of their attachment connection, but you're giving them a vision of where they're going. So you might say something like, so you can't see right now that he needs you. You can't believe really that he needs you because he just seems so independent. So you're planting the seed that eventually this partner is going to see how much he needs him or her, you know, but they don't right now. Okay, so you might pause and think, how helpful is this EFT information for your own future relationships? Okay, we're done with EFT. Let's move on to Gottman and the Gottman couple therapy approach. Okay, so as you know, John Gottman did, along with Robert Levinson, actually did extensive observational and physiological research predicting why couples stay together or separate in his Seattle-based Love Lab. So lots of basic research on couples, arguments, turning towards, turning away, what's happening in their physiology. So Gottman is a mathematician in his background, and that really strongly influenced his research. He married later in life Julie Gottman, who's a licensed psychologist and a clinician, and she really helped him translate this into the therapy room. Together they kind of formulated what they call the sound relationship house theory, which you could look up and see more about, and they have a Gottman Institute where thousands of therapists around the world seek training, and also where couples can come for, online or in-person workshops. So EFT has very strong research validating it as an effective therapy. It's called an empirically validated treatment, lots of randomized clinical trials, basically comparing it to control groups or other treatment approaches. Gottman's approach in this area is just getting started. So whereas Gottman did tons of basic research on marriage and tracking couples that stay together and tracking couples that break up and why, and then he developed, along with Julie Gottman, this sound marital house theory and a whole therapeutic approach, which we're going to be getting into. Research actually testing whether or not that approach works is just emerging. And so you can see some of the emerging research there, that the Gottman 7 Principles enhancement course improves relationship functioning. The Gottmans, there's a specific intervention, the dreams within conflict intervention, has been shown to improve emotion regulation, like increasing vulnerability or understanding. Couples who were struggling with infertility improved their emotion regulation. Gay and lesbian couples, which Gottman spent about a decade studying, showed increased relationship satisfaction following a Gottman couples therapy. Gottman couples therapy improved marital adjustment and intimacy, and that held true at a 2-month follow-up, and also helped reduce situational couple violence. So Gottman couples therapy is really nice for beginning therapists because it's very worksheet and activity based. So it gives you kind of clear things to do when you're not always sure what to do. As you're going to see, there's an extensive assessment process as couples and individually. Gottman really started by focusing on changing behavior and then moved to kind of cognition and then to emotion. He and Sue Johnson were friends and influenced each other. And so later in the Gottman approach did emotion start to become prioritized. Most of what Gottman is doing is assessing where a couple is at, figuring out what kind of intervention they might need, and then educating them on that through handouts, teaching them skills, videotaping them, having them watch it back, and giving them feedback on that, and really trying to coach them on how to communicate differently. So Gottman has an extensive assessment process, and it's an initial couple session, and I'll tell you more what happens there, then individual assessments, and then a feedback and planning session. So let's talk about each of these more in depth. So in that initial first couple session, Gottman therapists typically do a 90-minute session because it takes a while to get through all this. And they start with just kind of what brought you in. Then they do the oral history interview, which I'm going to walk you through on the next couple of slides, a problem-solving discussion and observation, and then they give them this assessment package to fill out. So as part of that initial couple session, the Gottman approach does an oral history interview and asks questions in all of these different types of areas: relationship formation, how they made the decision to marry or the transition to parenthood, good times in the relationship, hard times in the relationship, how their relationship has changed, and how they stay in emotional contact. And as you may recall, you're going to have the opportunity to do this in our class with a couple for the Gottman extra credit oral history interview. So you might want to just pause and find the assignment and check it out. Okay, so a Gottman therapist, when they're doing the oral history interview or afterwards, then they're going to evaluate the couple on 6 different dimensions shown on these next 2 slides. And so if you do the extra credit assignment, you'll be asked to do that as well and submit your evaluation. So the love map is it basically about how much do they have a clear map of the other person, what they like and what they don't like, what makes them happy, what pisses them off, what works or doesn't work for them in this relationship. So how much do they seem to know about the other is love map, and you're kind of rating that on a Likert scale. How much fondness and affection do they seem to show to one another? Positive affect, compliments, smiling, those kinds of things. How much disappointment and negativity do they seem to show? Conflict, disagreement, disappointment. Or if a couple can't really talk about like what brought them together, right? They're not having a strong sense of what attracted them to each other. That could be more disappointment and negativity. Here's the last set of dimensions. So we-ness versus separateness. How much does a couple seem to be kind of using we language versus I, me, glorifying the struggle versus chaos? How much when they're talking about the hard times do they say that they've gotten stronger, or we've gotten through it, we're now closer, versus more of a sense of chaos, like it's been overwhelming, we haven't been able to solve it, or we just haven't really learned or grown from it. And then in terms of engagement versus withdrawal, are they more engaged or avoidant when it comes to conflict in the interview, either individually, or as a couple? Okay, so the next part of the Gottman couple session assessment is to ask them to have a problem-solving discussion about something that they often disagree about. And once they're doing it, you're assessing or watching for a number of different elements, because Gottman has basically a worksheet and an activity for each of these things. And so if it's an area of weakness, then that gives you a sense of where you might go with this couple. So you're looking for how they start the conversation. Is it more in a soft way, or is it in a harsh way? You look for how, as they're in this conflict, are they rejecting kind of what the other person is saying, or is they accepting and like, yeah, you've got a point? When things start to get escalated and a person maybe makes a joke or something gives, throws the other person a bone or acknowledges them as a way to repair, how well does that go? How well is it received by the other? How much do they seem to be working towards compromise versus just digging in their heels into their side? What's the presence of the four horsemen, which we'll talk more about, you have read about? How much are they really kind of vilifying each other or seeing the other as the enemy or the bad guy? And then what's the level of emotional engagement or disengagement? So at the end of the first couple session, then a Gottman therapist would give each individual a packet to complete and bring back with them to their own individual session, where they would talk more in depth about personal goals, past trauma, family of origin, substance use, intimate partner violence, any mental health or psychopathology issues, current or past affairs, and their level of commitment to the relationship. So in the second couple session, after the two individual sessions, then the Gottman therapist would provide feedback on all the assessments, the couple assessments, the individual assessments, note the areas of strength, the areas for improvement, if applicable, provide some initial education about the four horsemen, then begin to kind of really solidify the client's goals in the context of kind of what the assessments revealed. Come up with a plan for what to do, and have possibly the very first intervention, which is where we're headed next, to talk about just a handful of the Gottman interventions. Gottman has a ton of interventions, and I've just selected a few to show you on the next slides. So a Gottman therapist might record a couple in a problem-solving discussion and then play it back with them and point out the presence of any of the horsemen, and then educate them about the damage that can do, what the research says, and what to do instead. And you can hear Gottman doing this in the Anderson Cooper clip. And so you might pause and ponder, which of the four horsemen do you tend to relate to the most or use when things aren't going well? Criticism is my go-to. So a Gottman therapist, in having watched that problem-solving discussion, might look and see where the couple could use some shoring up, where their weaknesses were, and then teach them some of these skills for solvable problems. So, and Gottman has handouts and kind of activities or role plays for each of these. And so you might educate them about a softened startup, instead of being harsh, saying something like, first off, I want to thank you so much for everything you did this week. One thing, though, is bothering me, and I'm hoping we could talk about it. And so, having the couple kind of learn about that, what the research says about that, and then practicing that. Teaching couples about the importance of repair, and you can watch Gottman talking about that in this short clip. I often think I'm actually not always so great on my first attempt with anybody in my life, my kids, my husband, but I'm really, really good at repair. So when things don't go well, I can fix it, most of the time. Teaching people about how to self-soothe, how to accept influence from their partner and not just be this brick wall of like, no, you're wrong, and how to move towards compromise. And so again, there's kind of handouts and activities for each of these things in the Gottman approach. Gottman has a questionnaire for couples after a fight. So they, let's say they come in to a session saying, yeah, we had a fight this week. The therapist might pull out this questionnaire, have them each fill it out to better understand what was happening for them during the argument, and then walk them through this process of basically taking turns talking about what they felt, what they perceived, and the role that each person played in the argument. The last Gottman intervention example that I'm going to share is the aftermath of a failed bid. So in all of our close relationships, there are times where we are trying to kind of make a little bid for our partner's attention. Maybe we are trying to, share a story or share an experience or tell us something funny or maybe we're trying to get them to have sex with us, we're trying to make the moves on them. And so these moments where we're kind of reaching out and maybe this other person misses it. They don't respond to our bid. And if that happens, that happens, of course, all the time in relationships. But if it happens a lot, then that starts to kind of erode the relationship happiness. And so one activity that a therapist can do is just tell me about a time this past week where you made a bid for your partner's attention and it got missed. And what was that like for you? And so there's again an aftermath of the failed bid questionnaire with over 50 items to help people understand what they were feeling, what their reaction was, and then the therapist can just help the clients have basically the conversation they never have had about that, so that in the future they're more in tune to those bids, so that they are less likely to get missed. Okay, so we've reached the end of Gottman, and you might think about how helpful is this, or how might you use this in your own future relationships. Okay, so we're going to finish up this material on what can you take from this, even if you're not planning on, for example, being a therapist, which most people aren't. What can you learn from EFT in particular, but maybe from Gottman too, about skills that you can use when working with dyads, which is basically more than one person, in a family, for example. So I'm going to walk through 5 different skills, and we're going to practice the first 4 that you might use when you're talking with more than one member of a family. So a couple or a parent and a child. And again, I'm thinking beyond therapists, but to people who might be teachers or health professionals or mediators who might have to have the skills to talk to more than one person, validate more than one person, kind of hold both realities at the same time. And so you likely have a class participation activity on this, and there's a worksheet that you're going to be completing related to these first 4 skills. Okay, so the very first skill is circular causality, which you're already familiar with, both from the family systems theory lecture and the couples and attachment lecture. And so I'm going to give you a scenario, and I want you to think about the problem cycle. How would you describe it? You can write it out, you can draw it out. And this scenario we're going to use for all 4 of our activities. So let's imagine that you're in charge of a meeting of parents for whatever it is, a workshop, you're a teacher, something like that. Afterwards, a couple comes up to you and the mother says, with some frustration in her voice, our son is in high school and his grades declined this year. I've been asking my son each day about his schoolwork and he says he's doing better, but I'm not sure. And then she kind of gestures to her husband and says, he thinks our son is doing fine and I worry too much. We have been over and over this. What is your advice? Okay, so now I want you to just pause and if you're doing the class participation activity, you can be looking at the worksheet and thinking like, how would you describe this problem cycle? Thinking maybe about their polarized positions that might apply. So is one person being more strict and the other more permissive? Is one over-functioning and the other under-functioning? How would you describe this problem cycle? So here's a sample cycle, right? And this can be the overfunction or underfunctioner, or could be kind of pursue withdraw, could also be pessimistic optimistic, a few different versions of these things. And so a therapist might actually draw this out for a couple, but if you're a teacher or another professional, you're probably not going into that much depth, but you could do this for yourself, even mentally, to remind yourself to think about this problem in a systemic way and not a problem that's just existing, for example, in mom. Another important skill is being able to build an alliance when there's more than one person in the room. So having an alliance with everybody, even if they have differing opinions. And you do this by validating each person while holding the multiple views. So you might say something like, I can hear for you that this is really stressful, even though your husband, might feel something differently. For you, this is scary. And I'm going to talk more with him in a second, but for now, I want to understand where you're coming from. So let's practice alliance building with the same scenario. Write a statement addressing one or both of the parents that both validates them and kind of gathers more information while holding the other person's perspective. So here's some alliance building statements that I came up with. Things like, This sounds like a challenging situation, and I'd like to hear Dad's thoughts on this too. Or, Mom, you see this as something Dad needs to change, and Dad, I'm guessing you might have a different perspective. Or lastly, Mom, I can hear that for you, the situation has been stressful or alarming, yet for you, Dad, you haven't been as worried. So, as we've talked about, family members are really going to be focused on the content. And of course, as a helping professional, you're going to have to attend to that, but you're trying not to just focus on the content, but also on the patterns and the underlying emotions. And it's the idea that even if we're not therapists, if we're just, other professionals working with families, if we can tap a little bit into their more vulnerable emotions, then we can sometimes kind of soften them to one another, decrease the conflict. We looked at this slide earlier in this lecture, so we're just reviewing this idea that people might be presenting a layer 1 emotion, and we're trying to take them a little bit deeper, a little bit more vulnerable. If you're not a therapist, if you're a teacher or a medical professional, then you're probably not focusing on going really deep. You're focusing on taking them maybe from layer 1 to layer 2. Okay, same scenario, and try to identify the mom's and the dad's layer 1 emotions and potential layer 2 emotions. So for example, dad in layer 1 might be like, I'm not really feeling anything, like nothing, but mom's layer 1 might be, I'm angry, I'm frustrated. Dad's layer 2 or so is maybe he's stressed that his wife is upset, and that might be harder for him than he lets on. And mom's layer, like 2 or so, is, she's afraid maybe that she's the only one worried, and she's kind of carrying that burden alone. So reframing is a hallmark of therapists, but other professionals can use it as well. It's when you take something perceived as negative and point out how it can be seen in a more positive way. I'd say sometimes we don't really know what to reframe. And reframing is most effective when we use our knowledge of theory or research to basically guide our reframes. So for example, we can use our understanding of systems and attachment related emotions to guide our reframes. But you might consider, are there times where we shouldn't be reframing something negative as in a more positive or compassionate light? So for example, if someone has been, emotionally abusive, we might be cautious about reframing them in a more compassionate way in front of the victim of abuse. Or, we might be able to say, I know your own challenges, stem from your own traumas, and you've been replicating a lot of what was said to you. You might be able to say that too. But sometimes, right, we're cautious about letting people off the hook, essentially. Okay, so reframing can be tough to grasp, so I've got 2 slides on it with kind of what to reframe and then an example. So you can, using your systems perspective, you reframe problems as existing in the interactions, not within individuals. So you might say something like, it sounds like you all have gotten stuck in a pattern of conflict that's been hard to get out of. You can reframe their actions as trying to balance out the family system. So when she is so upset, you try to be calm and rational in order to balance her out. You can reframe their behavior as normal given the situation. So when you're the only one worrying, you get more stressed. That makes sense. You're doing the worrying for everyone. Or you can reframe conflict and problem behaviors as due to disconnections between family members. So it sounds like you end up feeling like no one cares about your opinion, and then you end up feeling angry and hurt. Here's a few more ways to reframe. You can reframe family members' challenging behaviors, emotions, or reactions as due to caring a lot about each other rather than not caring. So that's more from attachment theory. So when Isaac shuts down, you see him as not caring, but I actually wonder if he cares more than you realize, and he just can't figure out how to fix this problem. Or you can reframe emotions like anger into more vulnerable emotions. It sounds like underneath your frustration, you're scared, as we often are as parents, that our child will not turn out okay or that we're not doing a good job as parents. And then lastly, you can reframe something as a strength instead of a flaw. Maybe like, it's not that you aren't stressed or you don't care about this, but you try to work hard to stay calm during stressful times. Okay, this is tough, but try to make a pass at writing a reframe for both dad and mom. And I'll give you an example. So for dad, you might say something like, your wife, says that you don't stress about this, but I'm guessing it's probably hard for you to see your wife upset. And then reframe for mom might be, when you feel like you're the only one worrying about something, it's almost like you're doing the worrying for everybody, and it becomes even bigger. Okay, so this last skill you're not going to practice, but I'm just going to mention. Obviously, it can be hard to change problem cycles and family conflicts, and we talked about this somewhat, a little bit, I think, during the end of the family systems lecture. But a strategy can be for each dyad, each two people in a family, to spend more quality time together. So if there's a 4-person family, you might have the parents spending quality time, each parent and each child, and the siblings, for example. And this is related to a form of play therapy called filial therapy, in which parents are taught to basically act like play therapists with their younger child for 10 to 20 minutes, and it's called kind of special time. For older children, it's simply just doing something together that the child or the teen enjoys. And research has found that filial therapy really does reduce problem behaviors and strengthens the attachment between parents and kids. So professionals can help brainstorm with parents, for example, activities that might work to help strengthen the relationship. This might be throwing or kicking a ball, or cooking together, or doing a craft. This can be something that the parent and the child already do together, but the parent begins to think of this as a time more as an opportunity for connection and puts other agendas aside. So we try not to bring up rules. We try to really let the kids lead, for example. And one-on-one time is especially important for dyads who are uncomfortable and not used to just being together, the two of them. All right, you reached the end of another pretty long lecture, so great job.